And I want to welcome you
Perfect.
again. You're one of our favorite guests. I know this is a very important topic for so many of our seniors. We really appreciate you providing this overview of the vaccine for our friends here at the Walpole Senior Center. As a reminder, everyone, this is being recorded for cable, so you can hide your screens if you don't want to be seen on television or on social media. And Eddie, I'll hand it over to you. Thank you so much.
Thanks, Gary. Just again, as a quick introduction, thank you very much to the Council of Aging of Walpole. You guys are awesome. I really appreciate the opportunities to do these talks, and I really enjoy doing it. For those of you who know me, hello again. Hi, Jean. For those of you who don't, I am the pharmacy manager of the Walpole Big Y. And I have a talk here about the COVID-19 vaccine. Is this the cure, is what I've named it. And as a quick overview, I wanted to go through the COVID-19 timeline. We see on the screen that in December of 2019, there was a very bad pneumonia outbreak in Wuhan, China. About a month later, the World Health Organization declared a public health emergency. And then another 4 to 6 weeks later, they declared a global pandemic. In April of 2020, the United States started mandating shelter in place, where they put into place what they called social distancing. I'm going to change that to physical distancing to stay 6 feet, because we're social animals and I think we need to be social. So physical distancing, wearing masks, one person shopping, sanitizing all the time, sanitizing areas that many people come in contact with. That's all part of the shelter in place. And then in July, we had stage 3 reopenings in most states. But then the holidays hit us in November and December, and we had to go back to closing up a little bit. And the bottom part of the screen you can see is the barcode there of the number of new cases in Massachusetts per day. And you can see that it started out at the beginning of 2020 with not very many. It peaked a little bit in March and April. Then it went down. Actually in June, July, August of 2020, we had less than 200 new cases a day. And then because of everybody gathering for the holidays, and I'm sure 90% of the people did everything right. They kept their physical distance, they sanitized, they tried not to get together with people they didn't know. But then when they sat down for dinner for 2.5 to 3 hours with their masks off, and they ate and they laughed and they hugged, we had some more spikes that came up. Current information just about the different, about COVID-19. So far, as of this morning, there's been 97 million cases in the world with 2 million deaths at about a 2.1% death rate. Here in the United States, we've done a little better at keeping our people alive. We've had 24 million cases with over 400,000 deaths for 1.7%, but it's a very virulent virus. Operation Warp Speed was something that was instituted in March of 2020. It was created with the goal, a very ambitious goal, to create over 300 million COVID-19 vaccinations by the end of this month, the end of January 2021. They're going to be real close to it, especially if Johnson & Johnson gets their emergency use authorization soon. Operation Warp Speed is a partnership between the following groups listed below. It was to accelerate the development of a safe and effective vaccine. It has the HHS, the Department of Health and Human Services, the CDC, the really bright people in Atlanta for the Centers of Disease Control and Prevention, National Institutes of Health, and then BARDA was something new I learned while I was writing this talk. BARDA is actually Biomedical Advanced Research and Development Authority, which actually reports to the Assistant Secretary of the Department of Health and Human Services. So it's kind of an offshoot of them. And then, of course, the Department of Defense is involved in that to round out the members of Operation Warp Speed. And a quick overview, over $10 billion has been appropriated to Operation Warp Speed since it began. Operation Warp Speed also talks to the FDA daily, and the two of them decided on 14 companies out of 100 who sent in blueprints for the vaccine. 7 companies were then given the authority to produce. Emergency use authorization was given to 2 of those companies in December of last year. And then McKesson Drug Wholesaler, which is the largest wholesaler on the East Coast, won the bid for distribution of the vaccine. And I'll talk about that a little later. It was another something new I learned every day. I do believe we should learn something every day, and I learned several things when I wrote this talk. I want to talk a little bit now about the vaccination. So who are the vaccine players? And since I'm using a baseball analogy, I thought I'd bring up Mr. Pedroia, who's a stalwart for the Sox. Hopefully he'll get back to play again. The roster is of those people that are leadoff guys is Pfizer BioNTech, and Moderna is number 2 slot, and they are also out vaccinating people with their product right now. Number 3 is J&J Janssen, 4 is AstraZeneca, and 5 is Novavax. It's interesting to note that numbers 2 and 5, the Moderna and Novavax, are biomedical research companies. They've never brought a vaccine for public consumption and public use, but they jumped right on to have this happen because this is a global pandemic. And the vaccine came to market, and so people are thinking that it came to market in December of last year, that from March to December, 9 months of vaccine was made, which is an astonishingly short period of time. The earliest the vaccine came to market prior to that was the mumps, and that took 4.5 years, but it really wasn't that short a period of time. I know I've done the talk before about COVID virus when it first came out, and SARS-CoV-1, the very first virus that was a coronavirus that happened in 2002 and 2003 in China, and then MERS, which happened in 2009 and 2010 in Saudi Arabia, are also coronaviruses. And since that time, they've been developing, companies in Europe and in Asia have been developing or researching, making a vaccine for the coronavirus. So it really has been work for a long time. The slide that we have up on the screen now tells us how our bodies produce antibodies to these specific vaccines. And they work in different ways. You see mRNA, which is messenger RNA that's been inactivated. You see with the next two, which is J&J and AstraZeneca, they have a replication defective viral vector, which also produces a corona spike that is inactive. And then the last one, the Novavax, uses a protein subunit from the COVID-19 virus. It uses what they call an adjunctive agent. That just means that it's kind of ramps up our immune system. It's something our immune system recognizes as foreign so that we make better antibodies to. All of them work in a different way, but they work to do the same thing. They create inactive corona spikes on our cells that we can then build antibodies to. You see the FDA status is the next line. 2 of them are already approved and being used to vaccinate the general public as of now. Right now, Massachusetts is still in phase 1, priority 3, which is healthcare workers who have non-COVID facing. So that would be somebody like me, a pharmacist in a retail pharmacy. You can see the refrigeration times. The Pfizer BioNTech and the Moderna all have to be kept under a freezer to be stored. But in the refrigerator, once they're thawed, they can last for 5 days for the Pfizer, 30 days for Moderna. And I have another slide that I instituted today because I have more information about the Moderna vaccine, since that's the one that Big Y will be offering and vaccinating with. We had a training video sent to us from Moderna and a fact sheet about it. So I want to share that with you too. There are 2 different colors on this slide. You see red over in the first column for Pfizer and then green for J&J. The red means that it has to be diluted. The Pfizer vaccine is one that has to be diluted. It's frozen. It's a lyophilized frozen powder. You have to dilute it with 1.8 mLs of sodium chloride for injection. And then you swirl it gently in your hands and then drop the dose, which is 0.3 mLs. The other ones do not have to be reconstituted, so their doses are all 0.5 mLs, and you just draw them up. The other color is the 1 in green under J&J, Janssen, and that is that it's a 1 dose. And actually, on the 15th of this month, Johnson & Johnson sent out their latest projections from their stage 3 clinical trials to show that after 14 days with just their 1 vaccination, they are 90% effective against the COVID vaccine. The other ones, you have to be the 95% you see, the 94% you see there is after your second vaccination, 14 days after your second vaccination. So the Pfizer BioNTech, as you see on the bottom line, you get your 2 shots 21 days apart. That's the same with the Novavax. And then the Moderna and the AstraZeneca are 28 days apart. So you're at full immunity after 5 weeks or 6 weeks, depending on which vaccination you get. This is the new slide that I just put in this morning for you guys. It's about the COVID-19 vaccine made by Moderna. It's stored frozen between -13 and 5 degrees Fahrenheit. And actually the CDC's and in our state, MIIS, which is the Massachusetts Information Injection System, is requiring pharmacies to have very high-tech thermometers, and we have those. They are Wi-Fi connected to the CDC, so they report every 15 minutes what the temperatures are to make sure we have a proper and constant temperature for our vaccinations. They can be stored, it can be stored up in a refrigerator once thawed for 30 days. An unpunctured vial means that you haven't dipped into it to give a dose yet, can be stored for 12 hours at room temperature. And then once it's thawed, we never refreeze it. Once the vial is punctured, you must use it in 6 hours. So that being said, on the website, if you are eligible for phase 1, you are able to go to the website for Gillette Stadium and you can check it several times a day because sometimes something might be opening up. If somebody cancels an appointment and they have an open vial, they're to use their best efforts to try to use up that vial and get all the people vaccinated. And then again, once it's thawed, you gently swirl it before vaccinating. You don't shake it up. The side effects profile is probably what everybody's worried about and talking about. There is pain at the injection site, and that's pretty much 85 to 100% of the time after both vaccinations. You can get a headache, joint pain, fatigue, tiredness, fevers, and chills. And then there's lymph node swelling only with the Moderna vaccine, which I put in there because it's probably the vaccination that you folks for the Council of Aging in Walpole will be getting. You'll probably be getting the Moderna vaccine. And it's only on the side of the body that you got the shot. So if you got the shot in your right arm, the lymph node underneath that right arm might be a little swollen, may not be. And these normally last a couple of days. It's normally seen after the second dose. And it's probably best to get the vaccine when you can rest the next day. So just to put numbers into perspective, these side effects occur with any vaccination. And in the case of the seasonal flu vaccine, these occur in between about 1/10% of the population. For the Shingrix shot, those of us who've had it, you know that that's also some of the side effects, and that happens in about 10% of the people. That being said, with the COVID-19 vaccination after your second shot, it's between 40 and 80% of the people are seeing those vaccinations. Now, if you've talked to somebody who got the first shot and they had those reactions to it, it's probably because they saw the COVID virus at a certain time in the past and fought it off on their own. They might have felt a little rundown. They may have been asymptomatic, but their body has built some antibodies. So after the first shot, they may see a more severe reaction and then nothing after the second shot. So we'll get into what group are we in, and I have a whole bunch of careers up there and job titles, and I'm really sorry, Carrie and Deb, I didn't put Council of Aging representatives on there. I've already been chewed out by Lena over in Westwood for that. So you are certainly part of the group. So how do we figure out what group we're in? The federal government did set a vaccine priority listing, and they use the designations 1A, 1B, and 2. And you can see the different categories that are listed in there. This is the federal guidelines. And when they pass this down to the states may adopt them as whole, they may adopt some of it, and they may alter it as to how they want to do that. And we see in Massachusetts that we have changed what the federal recommendations are. We've even changed the numbers. So in Massachusetts, phase 1 in order of priority are listed above: clinical and non-clinical healthcare workers, long-term care and assisted living facility residents and staff, our police, fire, and emergency care responders, congregate living facilities, including corrections and shelters, home-based care workers, healthcare workers that are not doing any COVID facing. So I fit into that group. So I'm in the last priority grouping of phase 1. And then phase 2, which is supposed to start, again, as of last night, it was still slated for February 1st of 2021. I don't mean to rain on anybody's parade. I have a feeling it'll be pushed back a little bit, but it's people with 2 or more comorbid conditions, and we'll talk about what those are in a minute. People over the age of 75 are in that first priority grouping as well. And then early education in K through 12 staff and workers, so our teachers, our educators, and the staff of the schools. And then the next grouping, number 3 in phase 2, is the essential workers. So your transit workers, grocery, utility, food and agriculture, your public health workers and public works people. 4th grouping is over 65, and then the last grouping is people with 1 or more comorbid conditions. And as we talked earlier, Deb, identifying those 2 or more COVID conditions will probably fall onto the vaccinators' responsibility to make sure those people have that. And normally doctors can either send us a screenshot of the second page of the electronic records, which has all the diagnoses for the patient on it, or they can send us a prescription. Don't have your doctor send it now, though, because my computer doesn't even have a designation for the drug COVID-19 vaccination. Probably will by the end of the week, but it doesn't right at this second. And then phase 3 is vaccinating to the general public. They anticipate that opening in April of 2021. All of those things being said, between all the vaccines that should be approved by then, by May 1st of this year, we should have over 300 million vaccinations available. So anybody who wants to get vaccinated certainly should be able to do that. Personally, I feel that we'll be vaccinating right up until next flu season in September of 2021 to make sure that we get everybody who wants to be vaccinated. And I think everybody should be vaccinated. But as you know from previous talks, I believe in vaccinations. These are the risk factors. This is the original screenshot from the risk factors for getting COVID, but these are also the risk factors for having a more severe reaction if you do get COVID-19 virus, and if you have more complications. So people over 65, people over 80 in a nursing home. And then we get into disease states like heart disease, respiratory disease or diabetes, and immunocompromised individuals. Those were all identified as of March of last year. And then in May, they added the last 2 with a body mass index of over 40, which is obesity, HIV positive people, homelessness, low income, cancer, kidney disease, and liver disease. And if you look on mass.gov and go to the COVID website, you'll see that for the comorbid conditions, those listed in the blue, red, purple, and pink that I have listed on your screen are all part of phase 1. And then if you look, there's a second grouping that says these may also add to your list. I have a wise guy customer who I golf a lot with, a friend of mine who said, so I have 1 and 1 and 2 and 2. So does that mean I have 2 and 1? And I told Bart, that's very nice, but I'll call him when it's time for him to get a shot. I want to talk a little bit about herd immunity. I'm sure you've all heard about it, and that's no pun. Herd immunity, by definition, is a form of indirect protection from an infectious disease or pathogen when a sufficient percentage of our population has become immune, whether we become immune due to a vaccine, whether we've seen the virus and fought it off ourselves, whether in the case of a newborn child, they get the antibodies from their mom in their breast milk. But it reduces the likelihood of somebody who has no immunity from getting the infection. And the next slide I'm going to put up shows what all vaccines are meant to prevent. They're meant to prevent outbreaks that lead to pandemics that lead to epidemics that lead to pandemics. So an outbreak is just a sudden increase in an occurrence of a disease in a certain place and time. An epidemic is the rapid spread of that disease to a large number of people in the population over a very short period of time. And then a pandemic is, the definition is that pathogen or that infection is something that's prevalent in a whole country or in the world, in this case with COVID-19. And again, it's worth repeating, all vaccines are developed to prevent this cascade of events from outbreak to epidemic to pandemic. Immunity threshold numbers differ for each different pathogen. Excuse me, I have 10 pathogens up there for you to look at. you can see the different number of percentage of the population that needs to be immune before we have herd immunity. Measles has a very high threshold, 92 to 95%. And as was seen in New York State in 2016, the threshold in certain areas dropped to about 75 to 76%. And if you look, most of the other pathogens, that would be perfect, that would be fine, but it wasn't. And so there were some outbreaks, isolated outbreaks of measles back in 2016 in New York State. Of course, our friend COVID-19 is in red, and we see that it's 80 to 86% of the population needs to be immune before we have herd immunity. Dr. Fauci originally put out in December a lower number, 60 to 75%, and then he increased it at the end of December. He said he did this purposefully because he didn't want to cause a panic in the communities with people trying to rush out to get it, to jump over other people to get the vaccination. You see that the influenza, the seasonal influenza on the bottom of the page on the right is about 33 to 44%. And that is because those viruses change very rapidly. Talk a little bit about vaccine distribution, and this has to come with what I learned of what happens. Every 3 years, the major drug wholesalers in the United States bid on a pandemic contract, which I had no idea about. So they bid to see who will be able to distribute supplies and vaccines if a pandemic hits. And McKesson won that one, so they're the guys that get to do it. And Operation Warp Speed contracted originally with CVS and Walgreens for the initial federal 1A, or here in Massachusetts, phase 1 vaccination. And the only reason they did that is because a very high percentage of people, over 90% of everybody in the US lives within 3 miles of one of the stores. It doesn't mean that your local pharmacy won't get it. As I said, we will be getting our vaccinations, and we will be slated for phase 2 vaccination when that occurs. And I'm sure if you use an independent pharmacy, I'm sure they'll be getting it too. And I'm sure Elaine in Walpole Pharmacy will be doing it. A little plug to our independents out there. Even though she's a competitor, she's awesome. She does a great job. So I'm sure she'll be getting it as well. Next thing I'd like to talk about is keeping track of how we're going to keep track who gets a vaccine when they need their second vaccine. How do we know who has what? And the federal government originally, and remember this talk was originally written back in December, and this was the federal government's answer to that. Oh, well, I don't know, we're going to leave it up to you guys at the state to deal with that. And so they did. Some states have reporting systems, some don't. Some have developed them since that time. And in Massachusetts, we're very lucky. We have the Massachusetts Immunization Information System that all vaccinators have to report to when they give a vaccination. And that is a really great tool for us to see who gets vaccinated. I put the slide up on the left side of your screen just as a joke that I guess if you asked if you got your vaccine, you could lift up your shoulder and say, yeah, I got my COVID vaccine Band-Aid on, so I have it. Or maybe a little button like when I voted today you could have, but that's really not going to be as effective as having a statewide system. And just to go a little more in depth about MIIS, they have recently come out within the last week and a half, come out with extra data that has to be loaded on. Normally, we have to load the data on for the regular flu vaccine, for the shingles vaccine, for the pneumonia vaccine, for hepatitis A and B, whatever we're giving. And there's no real time limit to do that. They recommend for the seasonal flu vaccine that it's loaded on within 5 days. Well, there is a mandated time limit for the COVID-19 virus. It has to be loaded on within 48 hours. And actually, we're very lucky. We have a pretty progressive computer system. So our computer system actually links to MIIS automatically, so that when you come in and get your vaccination and we scan the box, the QR code on the box of the vaccination to say you're getting that vaccine, it loads in the serial number, the lot number, the expiration date automatically. And then when we also, when you come in, if you've ever gotten a shot from me, and I know, Gene, you can attest to this, when you get the shot, we make you fill out a consent form. We load that in also with what arm you got your shot in, and what day you got the shot and who gave you the shot, and that is automatically loaded into the MIIS system as well. So it's really great that everything is all integrated, so it's loaded almost automatically once we have it in there. I believe it happens at the end of the day, with most things, is a computer download that loads it into MIIS. But it's a great system. So once we get our vaccine, things can go back to normal, right? We can go see a Sox game or go see the Patriots when we get a real quarterback. Sorry, Cam. When we go have a nice family reunion, and that kind of looks like all the nutcases in my family making faces up in the right-hand corner. We can go shopping again. And the answer to that is I'm going to put up this shot, which is a graph of new cases in Massachusetts of COVID-19. And you can see that, as I mentioned earlier, from July to September of 2020, we were down under 200 new cases a day because we were doing our physical distancing and wearing our masks, and only one person going out shopping when necessary. And then the holidays happened, and you can see the spikes. And as of January 5th, I believe we had 97 new cases of COVID-19 here in Massachusetts. We're down to, it was 5,800 and change 2 days ago when I checked as to new cases. But I think that we're in for a new normal. I think we should still be wearing our masks. I think we're going to be required to wear masks for quite a while. For those of us that watched the inauguration and that watched the Celebrate of America on TV last night, our new president has asked that we wear our masks for the next 100 days, his first 100 days in office, that we keep a physical distance of 6 feet if we can, that we sanitize, and that we get vaccinated. I can tell you anecdotally from sanitizing, in any normal pharmacy, the biggest antibiotic sale time for us, and I don't mean that that's a good thing, but when we sell the most antibiotics is from September to February. And at this time last year and in previous years, by now I've sold probably 4 dozen Z-Packs and gone through 2 bottles of 500 count amoxicillin. And I've probably sold a half a dozen Z-Packs now from September till now, and haven't even gone through 1 full bottle of amoxicillin. And that's because people are doing what they're supposed to be doing. They're wearing their masks. They're preventing droplets, as you saw on that screen previously for the threshold screen, how the pathogens are spread. Most of them are airborne droplets from our nose and our mouth. So if we're wearing a mask, those aren't getting out. If we're doing our physical distancing, we aren't able to get that. I mean, they can fly, but they're not going to fly 6 feet. So all of those things are real positive, and they really do help. I put up some information that are really good websites that you can go on to check. CDC has some awesome information. The CDC also has one part of their website that has to do specifically with all vaccinations. It's really, really well done. And it's in lay terms, so you can understand what they're talking about, because I don't know if you've ever tried to read some of the NIH reports that the CDC gets, but they're kind of complicated. Sometimes I have to have my medical dictionary out just to make sure I know what they're talking about. The World Health Organization has some good information there. The CDC also updates COVID daily in the United States, which is a nice thing to see. And then mass.gov does a very good job of putting information in. And Deb, you and I talked earlier that by 5 o'clock on Tuesdays and Thursdays, the site is updated on those 2 dates. So with that, I guess we can open it up for questions. After questions, I do have one more slide to show, but we can open it up for questions if anybody has questions. If not, I do have a group of questions that I got previously from other talks that I thought were pretty relevant, and I can answer those. So does anybody have questions? Deb, I guess you're going to be the one unmuting people.
Yeah. Eddie, are you able to turn off your screen share so I can see if people have questions? Thank you.
Sure. There we go.
Okay, so I guess
wow,
the
we have a
best
great
way,
group.
we do have a great group. The best way I think is if you raise your hand, I'll be able to see you on the screen. Linda, I saw yours first. Linda Wilson.
I just wanted to ask you about what I was referring to before is that I know the different sites are offering the different types of vaccine. Like one site has the Pfizer and another site might have Moderna. How do you determine which vaccine they have? And you said something about you don't have a choice.
You don't have a choice. Right now, the federal government has recommended that the states vaccinate with whatever they get. And so that's what it is. You don't have a choice. If you get signed up for a site, for instance, I signed up for a vaccine this morning, and I went with the earliest date, and I didn't put any parameters as to distance from where I am. So I actually was scheduled for a shot on Tuesday in Somerset at the Somerset Fire Department. I can tell you, Linda, that most of the ones you're going to get in the retail field, other than the hospitals, are going to be the Moderna vaccine. Only several of the CVS, Walgreens, I know in Connecticut it was 1,100 stores were given the original Pfizer vaccination. Here in Massachusetts, most of the Pfizer vaccinations went to the hospitals because they had sub-zero freezers. That has to be kept at minus 70 degrees. And most places don't have a sub-zero freezer. So, and you don't have a choice. When you go in to get your shot, if they have the Moderna, that's what you get. If they now, and because of how you have to use the whole vial before you can go into another vial, they may have, in their second stash some J&J, but they're going to use up what they have first because they're only good for a certain period of time.
Right. Okay.
And I don't think you can determine who has what. I don't think they will tell you. I don't think they'll tell you that.
Okay.
I'll tell you that I'm going to get Moderna, but I can't tell who has what.
And you said that you'll be able to book an appointment soon? As soon as
Yeah, our website at bigY.com, starting on I believe it's the 26th of January, we'll have a auto scheduler up there to schedule vaccinations. I don't know what it looks like yet because I haven't even gotten information from my bosses as to how it's going to happen. I do know that Big Y, as we were talking earlier, Deb, is very huge into making sure the community is important and protected. And we are looking at different areas. I know we've already hired certain pharmacists that are retired that want to help do vaccinations. We've hired some nurses. I'm in the process of talking with people in our area. I'm going to contact Dr. Haj at Norwood Urgent Care because they just moved into their very large facility, and I don't know if they're going to be vaccinating, but if they're not, would they be willing to hold clinics? Vanderbilt Club, many of us go there to exercise. I'm there pretty much every morning at 5:30. And I know Sue has kindly offered her rooms that she's no longer using to do that. So Big Y is looking at places where we can hold community vaccination clinics. And I know, Deb, you and Sherry and Carrie have talked about maybe we can do something with Walpole. I don't know. I don't want to get any of your hopes up that it would happen, but everything's fluid nowadays.
Right. Now, also, will it be required, like in most sites, I understand you have to stay for at least 15 minutes after you get the shot?
I love you being on, Linda, because you always have some really good information, and that's absolutely true. If you have never had a reaction to any vaccine at all, you have to be observed for 15 minutes. And I can tell you, when we first started vaccinating 10 years ago with the flu vaccine, we would have people walk around the store. They could go do their shopping and then come back and see us. And I would check off that we saw them in 15 minutes. And that is not appropriate for this vaccine. It has to be an observed 15 minutes. If you have had any kind of a reaction to a vaccine and it was semi-serious or serious, you have to be observed for 30 minutes. So that is absolutely true. And that's a great point. Good question.
Eddie, to piggyback on what Linda was talking to you about, and you're saying that your site is going to open on the 26th to accept appointments or interest in appointments. Is that only for people 75 and over and the two comorbidities, or will it be for 65 and over or general public?
That's an awesome question. It will be phase 2 and it will be priority 1. So I'm sure the website will delineate.
Okay.
Don't only sign up for it if you are over 75 or you have 2 comorbid conditions. I don't know if it's going to show how we require that. I know that the website that I went on to sign up for my shot told me what I needed to bring to prove I deserve to be in phase 1 priority 3 to do that. I have to bring my pharmacy identification license, or a photo ID of my employer's ID, which we do have. I have all of that information to prove that I am a pharmacist, that I am allowed to do that. I don't know whether the website will help you with that. Right now, we just got preliminary information, but again, it's evolving every day. So I'm sure that it will be. It'll say, these are the comorbid conditions that are required. If you have 2 of those, sign up, and maybe we'll tell you how we're going to get that information later. We may comb through it and do it from a central location and have the doctor send it there so that when you do show up and see us, we'll be able to do that.
Okay, great. The Adlers?
I have a question. I apologize because we came in late. On the website for the Mass General Brigham, it mentioned that if you are 65 or over for the first phase, that you can have your vaccine. But on other websites, I had seen 75.
What website are you talking about that said 65 and older? The last website that I looked at last night was the mass.gov, and their phase 2 priority 1 was 75 and older.
Okay, and phase
65 and older was in phase 2, but it was at the bottom of the priority. If you read how they list it, and they don't put bullet points, which would probably be really helpful. They just list them all out on a line, but it says in order of priority. So the very first grouping, I can tell you, the very first grouping is 75 and older, and those with 2 or more comorbid conditions.
Okay, but
And
Go
so
ahead.
that's federally, the federal government wants all the states to vaccinate 65 and above. Most states have complied with that and have allowed that to happen. But Massachusetts, we're one of the first states, and we're the guys that threw the tea in the water. So we're going to go our own way. And it's not a bad thing. I'm not saying it's a bad thing.
when does phase 2 actually begin?
That's a great question, and I have no idea. It's supposed to start February 1st. My personal opinion, and I'm nowhere near as smart as any of the guys making the decisions, is that it's going to be pushed back a little bit later.
Okay. So we just stay tuned.
Yeah, just stay tuned. You can, if you're shopping at the grocery store, you can ask John or I or Tracy anytime, hey, when's phase 2 starting? And if we know, we'll tell you.
Okay.
We will also, just as another added point to that, for those people that don't have computer access and aren't really as computer literate, and if my parents lived in Walpole, I would be there helping them with that. We will have tablets at the pharmacy department when the site is up and running that people can come in and sign up for a slot.
Thank you. We'll see it there.
Carrie, go ahead.
I just wanted to reemphasize that there is a press conference scheduled shortly in about 20 minutes at 2:00 today, being the 21st of January for future airings of this program, not today, maybe in the future, that they are going to provide some updated guidance. So tune into that. Things may move, as Eddie's indicating. Sounds like things may be moving a bit.
Well, it could be, and it could be that they're actually upping things, because I know that in the inauguration speech, President Biden is he's appropriating a lot of funds to getting this vaccine. Our new and current president is very huge into science, and so he wants to make sure that our country is protected. And I'm not saying the other guy didn't. Don't get me wrong.
Jean, I think your hand was up.
Yes, thank you. One more.
Oh, I'm sorry. It was Jean Golden I was looking at, but go ahead, Jean.
This too? Yes. If you have the Moderna, should you have vaccines of the same kind?
I didn't hear that.
Are you supposed to have, if we have to have 2 injections, and should it be the same vaccine?
Yes, absolutely.
Oh, yeah.
If you get your 2 injections, have to be the same. So if you get the Pfizer BioNTech first, you got to get the second one from Pfizer. If you get Moderna's first, you have to get your second one from Moderna. Good morning, Mrs. Golden.
Jean Golden, go ahead.
That was my question, but my second question is, will they be giving any shots at the store? itself?
That's a good question. Right now, the answer is
hear me?
probably. We probably will be. We have the room that we're going to do it. I think we're going to do it back in June. We did do a shingles clinic because I had a lot of people that needed their second shot. And what we did is people came in, registered. We gave them the paperwork to fill out. They went out to their car and we called them when it was time for them to come in to quickly pay and sign at the register and then go into the room and get the shot and then leave. The problem with that now is that you have to wait 15 minutes. So I don't know, and it has to be an observed 15 minutes. Right now, due to the reclosing of going back to phase 2 for gatherings, our food court is closed. So that would be an ideal place for people to be 6 feet apart to, you know, if we were giving a shot every 10 to 15 minutes, that would be a great place for people to gather. But it has to be observed. So I don't know how we're really going to do that. I know that there's talk of, I have every Tuesday off. They were asking me to give back one Tuesday a month. John has every Wednesday off. They were asking him to give back one Wednesday a month. You know, in the interim to get vaccinated, they're looking at doing with these ancillary people that we're hiring, doing 2 or 3 4-hour shifts where they will come in to do the vaccinations at our store. But if we did it all at the food court, that probably would be okay. But I think we're going to do some. But we're also looking for off-sites. That's why I was talking with Dr. Hodge down at Norwood Urgent Care, like I was talking to Sue at Vanderbilt, to have a place where we could do the vaccinations.
Any other questions?
Okay,
I do.
thank you.
Mr. Adler first. Go ahead.
Thank you. I was just wondering, having come in a little late, I think you were just saying February 26th, the big Y notices to making reservations. Is that when it is?
January 26th.
February 26th.
January, Mr. Adler. Next week, our website should be up to start to do some of the scheduling to do it. I know that because I believe in vaccines, my boss has actually tasked me to train our 2 technicians on giving vaccines. And then it's probably going, if you've been in the store, you know, Tracy is there and she's super competent. And Tracy and I will probably be the ones going out into the community to vaccinate.
Thank you.
Sure.
Go ahead, Linda.
Yes, I just wanted to make a statement as a nurse who's familiar with vaccines and what they do and don't do, is that as a group, and as this is probably the worst thing I've ever seen in my lifetime, is that you have to be careful about who you talk to in terms of getting the vaccine. There's a lot of controversial information about it. Do I get it? Don't I get it? What? And I guess you have to trust the science. And I, as a experience, a young physician that I've known for many years, and she works in a hospital environment. She had some really adverse effects to the second shot of the COVID. However, whatever happened and why it happened, she still is advocating for getting the shot because she's seen the patients with COVID and she said, COVID is far worse. So what you have to do is realize that the benefits do outweigh the risk.
Thank you,
That's all.
Linda. That's absolutely true with most vaccinations. Just to kind of reiterate that, and you can tell people this, that if they get COVID and they have to be hospitalized and they do not recover, we hope that they do, but if they don't recover, they're going to die alone because nobody can go and see them, nobody can go and visit them. It is a very communicable disease. It's just like that with the shingle shot. There's, as I said, about 10% of the people have those reactions. About 1% of the people have pretty severe reactions where they want to just lay in bed and watch Gilligan's Island for 6 hours. But they come and get their second shot because the science is there to show that it will protect them for 97% against getting shingles. And that's very important. Let me cover some of these other questions that we have that are important. Under an emergency use authorization, can an employer force me to get my vaccination for the COVID-19? And the answer is no, they cannot. I know that over the last 5 years or so, flu vaccines have been required at healthcare facilities, hospitals, clinics, that you have to get it. And if you don't get your flu shot, you're not coming to work. And so that is not the case with this because it's under an emergency use authorization. When it gets fully approved, probably by the end of 2021 or early 2022, maybe they can force you to do that. I don't know. We'll see how many people are vaccinated. I do know that there are some retail establishments out there, because retail people are frontline workers or essential workers, are actually paying 2 hours worth of time to get the shot to each of their employees. How do people get notified when it's their time? It's up to you to sign up for it. And you have to be honest and go by the guidelines that are there. Now, have I ever heard of anybody signing up when they were under 75 and went to go get the shot, or they said they were a fireman, but they really weren't and went to get the shot and got turned away? I haven't. I don't know if that's the case, but a lot of times people don't always tell the truth. And I can tell you this from semi-personal experience. My son, my middle son, is a geotechnical engineer. He runs a construction site of 200 construction workers, and he got COVID. He has to take their temperature every day because somebody, maybe more than one somebody, didn't tell the truth on their form. He's fine. Everything's great. He was home for 2 weeks. He just felt tired. He went back to work today. So he's fine, but you have to be honest on the form and you have to fill that out. Can you choose the vaccine? Linda, we have exhausted that one, which is great. Thank you. You can't choose the vaccine for it. Is it a yearly vaccine? Probably not. The original data that they came out said, oh, we don't know. I like to, my only Spanish that I know is, yo no sé nada, solamente trabajo aquí. And that means, I don't know anything, I just work here. But I don't think that that's the case. I know that if you have had COVID and you fight it off, you are immune for about 90 days. And they're looking originally, I think it was, I believe it was the Moderna vaccine, and some of their secondary trials after being released said that maybe every 2 years we'd have to get it until we eradicate this bug, especially with the changes that are occurring in the virus itself. When will we all be vaccinated? I think I talked personally, I think we'll be vaccinating until September of this year. And those are the questions I had. Does anybody else have any more questions?
Danielle, go ahead. Just have to there
Yep,
you go.
I did. Thank you very much for this information. It's been wonderful and very valuable. I just have a quick question. There was some talk on Biden's team thinking that if there isn't enough vaccination to go around for the second shot that you need, they'd rather have everybody get the first shot and wait a little bit later to get the second shot. Would that diminish the efficacy of that vaccination?
The quick answer to that is probably. It probably would. The reason that we're told from the vaccinations, the companies that make the vaccinations, obviously vaccines don't talk. The reason that we're told that is because that's what their studies have shown. That's how they reach the 95, 94, 95.5% efficacy to do that. I can tell you that during the shortages of the shingles vaccination, because we had a longer time frame to get your second shot from 2 to 6 months, I was in that group, Danielle. I was one that said, hey, I'm going to give you the first shot, and I'm going to hustle my butt off to make sure that I get it. I'm very aggressive at getting vaccine. I never missed a shot, even though there was a shortage and people went without at other facilities. We have not been given that information yet. Right now, as it stands, the information that we got, which is a week old from at Big Y, our people, is that if we get 100 doses, that's 50 people. So I don't know what the efficacy levels will be. In the medical world, 2 is better than 0. 50% is better than 0%. So maybe that's what they're going to do when they do that. I know that I've had this talk with several of our customers. Statins are terrible, lowering your cholesterol. It's a bird walk a second. And a lot of people have reactions of muscle pain with that and muscle aches and pains. But if you take it 3 days a week and it doesn't cause muscle pains, it's better than not taking it at all. So it may be that case. Right now, I haven't heard that. May be coming out in the press conference based on what was disseminated from the federal government to the states. But right now, as it stands, I'm told that 100 vaccines is 50 people. There was a podcast out last week that stated, it was from NPR, which is kind of a reputable place to get your information. But it didn't delineate the number. And what their number was is that only 25% of the vaccines that are out in the public have been used. And is that 25% of the number of vaccines or 25% of the vaccines, meaning that it's half the people that could be vaccinated? And I don't know the answer to that question. And it wasn't delineated in the podcast, so I didn't get a clear response to that. Anyway, if it's really 25% of the population, that's kind of criminal. We should be vaccinating our people. But if we have to have a 30-minute watch or a 15-minute watch, observed time after it, there are constraints for that. There are room constraints when we have to physically distance. There's time constraints as to how many people do you have watching how many people.
Thank you very much. Thank you.
You're welcome. Anybody else? So my last screen I want to put up real quickly is this guy here. Maybe I'll be able to do it. There we go. I just have to move you guys so that I can move that out of the way. To say that we're in a new world. Oh, look at that. What a silly boy. We're in a new world, that things are different. And I think that we have to do that. We have to make them different. So this is our new world. This is our new beginning. And I think if we all work together, we can take care of it. Hope to see you all at my place to get vaccinated.
Okay.
I hope they allow it all to happen.
Okay.
Thank
This
you.
was
Thank
so
you.
great. Thank you so much, Eddie.
Thank you.
Thanks,
for
Eddie.
the
Always a
opportunity again.
pleasure.
Terry, could I ask you a question before we sign out?
Sure.
So you want me to go?
Oh, yeah. You can.
Linda's saying, go away, Eddie, go away. You talk too much. It's like at the Chinese restaurant when you have the buffet, they say, go home, fat boy, you eat too much. All right, I'll see you. That's happened to me,
Eddie.
Carrie. It really has. I'll see you.
Bye, Eddie.
Bye.
Thank you.
No, this is a question related to my coming to the exercise on Tuesday. And my daughter's visiting for the weekend from New York. So should I watch the class virtually?
Technically, you should, unless she has a negative test or is quarantining for the time that she needs to quarantine.
Well, I know she has a negative test, but you know,
Well, it would need to be a negative test within a certain number of days of arriving here to visit you.
yeah, well, I don't know the answer to that, so I'll probably do virtual. I won't.
I appreciate it. I do.
That's okay. We'll see ya. Thanks a lot.
All right.
Yeah.
Thanks, Linda.
Yeah, bye-bye.
Bye.
Thanks, everybody.
Thank you. Very good.
Thanks, Deb.